Good afternoon, good evening, good morning. Welcome people from around the world. This is to the New York City Pandemic Response Institute's webinar. We're happy today to have the first one that we're doing in this broad approach over LinkedIn and YouTube, using quality communication to build trust in public health and to demonstrate quality communication amongst a great panel and lead author that we have here today. So let me just start and remind the challenges that we're all facing. I'm Dr. Scott Ratson. I'm one of the co-leads at the Pandemic Response Institute at CUNY School of Public Health here in New York. And we've been working on a variety of activities, exploring the challenges on ways to advance the provision of quality health information in an era where deterioration of trust in our institutions, media, and the purveyors of public health and medicine are challenged. We've seen this, of course, with the recent COVID-19 pandemic, and the challenges today even more so with both the political polarization, some of the realities that we face with uphill battles with the political landscape, as well as the difficulty of reaching a public, whether it's via social media, legacy media, or even events like today. So today we're really happy to have Dr. Sara Gorman. Her recently published book, The Anatomy of Deception, Conspiracy Theories, Distrust, and Public Health in America, highlights the polarization, very well presents some of the challenges that we've had and the threats to public health and societal progress. Today we're going to talk about some of the parts of her book and some of the interventions, and be joined by excellent panelists. So kind of the three areas we'll be dealing with are one, effective health communication strategies and methods for building confidence and social well-being, community-based approaches for health progress and rebuilding trust, and thirdly, strategies to rebuild confidence in public health agencies, healthcare systems, and our institutions that are engaged with health. So before I introduce Dr. Gorman, I'll just mention the other panelists that will come on afterwards, and I'll do a proper introduction with them subsequently. So Bob Pezzolozzi, who's a public health advocate and a convener in Interfaith Public Health Network, will join us. Adrian Verrilli, the Assistant Commissioner for Communication in the New York City Department of Health and Mental Hygiene. And Dr. Sandra Elbrecht, who's Assistant Professor of Epidemiology at Columbia University, and also a founding member of those Nerdy Girls. So I'd like to get right into it and introduce Sara. Sara has just been a terrific advocate of public health, and this is not her first book. She's a public health expert and co-founder of Critica, and also executive director of those Nerdy Girls. She's been a researcher in public health and an author based here in New York, and has written extensively about psychology, misinformation, science denial, and behavioral science. Most of her work has appeared around the world, but in a lot of the mass media publications of Time Magazine, The New Yorker, Science, Scientific American, Psychology Today, The Atlantic, New York Medicine, New York Magazine, Daily Kos, NPR, and others. Let me also mention, I am the editor of the Journal of Health Communication, and I'm proud to say that we had a great review by Dr. Ken Rabin of Sara's book, also published in our journal, which you can find. Sara's first book was Denying to the Grave: Why We Ignore the Facts That Will Save Us, also published by Oxford University Press a number of years ago, and a second edition revised in 2021. She's been very deeply involved in investigating the causes behind the uptick in distrust and what that means for the healthcare system, not only here in the United States, but applications around the world. And some of those are also brought forward in her book in some of the potential solutions of where we can learn, so we say the proverbial US health polity can learn from other systems and other projects that are being instigated. And then finally, let me just mention, Sara is also executive director of those Nerdy Girls, an interdisciplinary team of women and non-binary researchers and clinicians providing factual and practical health information to empower individuals to better navigate science and health information. Sara does this at the same time while she's CEO and co-founder of Critica, which is a research group to develop and test new methods of advancing public acceptance of scientific evidence. So obviously there's a lot I could keep going on with Sara, but we're really enthusiastic that she's joined us today with the Pandemic Response Institute. She has contributed in some of our live events that we've had both at Columbia and CUNY School of Public Health. And we're really proud that we have this also linkage with the city and others who are participating today. So over to you, Sara. After Sara speaks, we'll have some slides. We'll have the opportunity for Q&A, and all of you, please use this platform. If you haven't submitted questions already in advance, use the chat function, and we'll hope to get to many of those in the next 90 minutes or so. So, Sara.
Thank you, Scott. Just want to see if I can get my slides up here. Yes, perfect. Okay, thank you. I'm really pleased to be here today, and I know this is going to be a rich discussion with the panelists that we have waiting in the wings. So I wanted to just cover some of what I found out in my book about trust in the healthcare system, and I'll interweave some findings about health communication and how it intersects with trust, which is obviously in a very significant way. And then as I understand it, we're going to have a broader discussion about trust, misinformation, and quality health communication. So for my book, I did over 70 in-depth interviews with people who self-proclaimed as having low trust in the healthcare system. And this was a fascinating exercise, and I learned a lot from it. And I want to tell a few of those stories today because I really think that it brings things alive. So the first one I wanted to mention is a story about a woman. I'm not going to use her real name. I'm going to call her Deborah. And I didn't speak to her. I spoke to her daughter, who told me that Deborah was retired from Lowe's Corporation. She was living in Western Massachusetts. And all along, she had good faith in the medical system, including a vaccine. She had all of her children vaccinated on time, and she never questioned anything. And then about 10 years ago, she threw out her back, and she really struggled to find a medical provider to help her with her chronic pain. So she ended up going to a chiropractor who got her into energy medicine, which, if you don't know, actually carries a lot of pseudoscientific beliefs with it. And she became increasingly conspiratorial and isolated. She shunned medical care. And she had had a heart attack before. And one day she had blinding abdominal pain to the point where she couldn't speak or eat. And her daughter, with whom I was speaking, pleaded with her to get medical care, and she just kept refusing. And eventually, one night, her husband found her dead on the floor on her way to the bathroom. And so why am I telling you this story? Well, there's a couple of reasons. First of all, it was a common theme across my interviews that maybe this doesn't surprise you, but that trust has real immediate health impacts. So during the pandemic, trust was related to whether or not people got COVID vaccines and whether or not they masked and social distanced. So it has real effects on actions that people take and decisions that they make about their health. Second, and I'm going to come back to this, I really want us to think broadly about the connection between high quality access to care and how it intersects with trust. And I don't want us to just think about access as who literally has the means to, and transportation means and financial means to seek out medical care, but as a concept that also encompasses the decisions people make about who they seek care from and whether they get pushed into seeking alternative care. And I think that third of all, I really think that everyone in healthcare, including me, needs to be responsible for the people who are left behind in this way. So not just for people who don't have the actual means to access healthcare, but people who access healthcare in a different way that may contradict their health goals and may be against the best practices that could be best for their health. We need to really prioritize these people. We need to be responsible for them, and we need to figure out what to do about the trust issue that's facing this population. So given where we are today, I know the word democracy on a slide like this is loaded right now. But I do want to talk a little bit about, because I found in my book that there were deep connections between the way that our democracy is proceeding and the way that people feel about the healthcare system. I wanted to say a word or two about why trust in the healthcare system is important for larger issues in our society, including the future of our democracy. So I found in my research for the book that everything is really connected. So trust in the healthcare system was connected to trust in the government. People really felt, and they told me this in my interviews, that they felt that the government should be taking care of their health or well-being. And when it wasn't, they would turn toward conspiratorial ideas, they would turn away from the government, and they would be more likely to be radicalized. So there was a real connection there, and healthcare was a huge issue for people. And I want to read a quote from Andrew Werman's book, The Contagion of Liberty. It's a little bit of a long quote, so just bear with me, but it's very interesting. He says, for ordinary Americans, inoculation compelled the same sacrifices and the same common commitments that winning the revolution required. In newspaper debates, town meetings, and sometimes the deafening shouts from an incensed mob, inoculation and independence both demanded an insistence on shared burdens, an unwavering commitment to fairness, and a deep suspicion of individual ambitions and undue profit. Within those heated arguments, ordinary Americans discovered that their ideal government was an energetic one that responded quickly to preserve the lives of all people and in the process generated both public trust and public health. So Americans were chasing the twin goals of independence and inoculation. This is Andrew Werman's argument. Their ideal government was one that worked hard to preserve the lives of all. And so he really says that this was in the fabric of the founding of our society, that public health was really part of the fabric of the founding of our society. It was very important, just as important as winning the revolution. And so his argument throughout the book is that this pairing of democracy and public health has never gone away. And my research for the book, as I've said, really bore witness to this. People were saying to me in the interviews, why is my country not helping me? And why is my country not looking after my health and well-being? And that was all sort of part of the same betrayal. So as I write in the book, the betrayal of the government to care for its people on such a basic level as securing their health and well-being has led to increasing alienation of citizens from the centers of power and increased willingness to believe in fringe ideas and alternative political viewpoints. The government has abandoned us, and we have abandoned the government. So a real connection there, as I said, between the healthcare system and what happens with the future of our democracy. So what is the American trust problem, the healthcare trust problem, really driven by? So in my research, I found that it was really had a key driver, and that was access to healthcare, which I mentioned earlier. Access to healthcare kept on coming up no matter where I turned. It kept on coming up as a key thing that really made people either turn away from the healthcare system or be able to turn toward it, depending on how much access they had to the healthcare system. So I want to share two more examples from my interviews. So I spoke to one participant who had chronic pain, and this was actually quite common. A lot of the people I spoke to talked about having chronic pain and feeling like the healthcare system didn't have anything to offer them. So this particular person told me that her parents were teachers, so she had good health insurance growing up. But when she left their house as an adult, she had to buy her own. And she remembers, she says, being 20 years old and having to spend at minimum $600 a month for healthcare. And she told me that she would have panic attacks when picking up her prescriptions. It was her anxiety and her dismay at the system was so extreme that she would have panic attacks when she was waiting to get her prescriptions. And she said, I just think it's disgusting that in the US, that this is how we treat people who are chronically ill. So she was seeing this as really a globalizing issue where, as a whole, the US was not taking care of her. And she also told me that she felt that Western medicine doesn't want people to get better because then they wouldn't profit. So again, tending in this direction of the conspiratorial. The less access she had to the system, the more conspiratorial her thinking got. Sometimes she told me she would have to pay for her opioids out of pocket for an extra $400 a month. And of this, she said, I would rather I would rather kill myself than go through what I experienced before again. I am not doing that, period. So again, very strong words, but as we can see, that access to the healthcare system really drives the feelings about whether or not how somebody feels about the healthcare system. And the trust in the healthcare system quickly follows. And then I have another story. Sorry, I'm just going to take a drink of water. So, thank you. Okay, I have another story about Aunt Cynthia. I spoke to both her and her nephew. So Cynthia grew up in Montana, rural Montana, but when she was 20 years old, she got married and she lived for 30 years in Norway, where she had universal access to healthcare. So she had terrible access to healthcare in Montana, and then she moved and had great access to healthcare. And then she moved back to Montana about a decade ago. And as part of this process, when she was growing up, she didn't trust the healthcare system. She never sought out traditional healthcare. She shunned the whole system. When she went to Norway, she did seek out healthcare. She did trust the system, and she wasn't involved in the healthcare system. And then when she came back, she went into deep right-wing conspiracy theories, starting with the belief that deodorant has harmful aluminum in it, moving to 5G and Bill Gates' COVID microchip conspiracy theories. She also believed that viruses weren't real and that AIDS didn't exist. So really strong conspiratorial thinking. And the point is that her trust levels actually vacillated as she gained and lost access to the system. So what was interesting to me was that vacillation. And she actually did say to me, why would I trust a system that I don't have access to? So again, these examples really highlight the access-trust connection. And actually, in some cases, this isn't always about actual access. It can also be about perceived access. But either way, that sense of the access to the system is what really drives the trust or distrust in it. So now I want to talk a little bit more directly about the communication problem and how it connects to trust. Trusted communications are, as we know, at the very center of a functioning democracy. And we also know that communication is a large part of how people know that whether or not they are cared for by the government. So a lot of that comes through in communication, and that's a big determiner of trust, to feel like whether or not the government has their back. And in my book, I go through a lot of examples. I go through in very detailed way some of the press briefings that happened around the early days of COVID and some of the communication missteps in those and how those sowed a feeling of distrust. And so I think it's interesting to look at COVID in particular, because I think crises really lay bare our fundamental communications and competencies and can show us some of our greatest weaknesses. So during COVID, the administration specifically faltered in answering questions about how they were going to maintain people's access to healthcare when a lot of people were losing their jobs. So let's look at an example of how this didn't go so well. So here is Donald Trump in 2020. So, I mean, the things I just read to you are being considered, and other things are being considered. People are going to be getting big checks, and it's not their fault. What happened to them is not their fault. So we're doing a lot of different things on health insurance. We have meetings on it today. So that was his response to someone asking, what are you going to do about the fact that people are losing their jobs left and right, and they don't have access to health care at a time when obviously they may need health care more than ever? And so, as you can see, I don't need to tell you this response was not very reassuring and didn't instill a sense in people that the government had their backs during a crisis. So, that was a big misstep, obviously, and not unique. There were many other examples of that. And, in my interviews, I saw a lot of evidence of many people who, before COVID, were trusting of the government and the healthcare system, and they really turned away during that period. And it was sort of things like this. that facilitated that. And they would go on to embrace a lot of conspiracy theories, like pretty readily after losing their trust. I also want to point out that communication is really central to how a government functions, especially during a crisis. So if you think about it, governments are often judged during a crisis on things like competency, compassion, credibility, and correctness. And if you think about those qualities, so many of those are related to communication. How do you convey those things? Really through communication. And so it really shows how paramount communication is in a successful response and building trust, and maybe sometimes even more than action. And so we really need to get this right. And that's what I'm hoping the panel can help us figure out as well today. So finally, I just want to, what should we do? This is always the hard part. I have a few ideas of things that we could do to help build back trust in healthcare, but I'm hoping that, again, this is something that we can talk about a little bit more in our panel discussion. So from a research perspective, there's actually still a lot we don't know. So we don't have good longitudinal studies of trust over time, trust in the healthcare system. I just talked a little bit about how some people's trust vacillates over time. That was fairly common in my interviews. And I think we don't have a good sense of where and why and when that happens, and how it could control, sort of, determine how we decide to do interventions, at what points, and how we target them, et cetera. The other thing I found in my interviews is that I spoke to a lot of family members of people who had low trust in healthcare. And I found that a lot of these family members were doing some creative things to try to sort of help their family members regain their trust and get out of conspiratorial thinking. And I think that we need a lot more work to sort of canvass those examples and test them and see what's actually really effective, because solutions may be actually hiding in plain sight. I also think, because of my hypothesis about access and trust in healthcare, anything that increases access to the healthcare system should be embraced as a way to build trust. And so some of the things I've seen lately that should be championed are things like reforming PBMs and prior authorization to give people better access to prescription medications, improving access to FQHCs. Anything along those lines that really helps improve access is going to do something for trust, ultimately. So we know that those are good things to do anyway, but what I'm trying to impress on you is that they're actually part of the solution, specifically to improving the trust problem. On the communications front, we just need to be centering the place of communication and building a strong democracy. So that means all of us here and listening here, as well as all of us in the field, need to be advocating with all of our professional associations in healthcare to center the place of communication with more training and research on the best practices and impacts of high quality communication. And we need to lobby our political and public health representatives to take a firm stance on responding to misinformation swiftly and in an evidence-based way. So these are just some preliminary steps we can take in building back trust and better communication. And I'm hoping that we can have a really robust discussion now with the panel. So put my thank you slide up. Thank you. Thank you for your attention. And I think I'm handing it back over to Scott.
Excellent. And let me say thank you for sharing some of those observations and telling the story about people who you've interviewed for your book. Let me just remind the Anatomy of Deception. It's an excellent book, and I have just read it, so I'm going to ask a couple of questions, and we're going to adopt it in the class I teach at CUNY School of Public Health. So you'll be having other observations from people who are actually learning and dedicated to health communication for social change. So one of the pieces that you focused on here today was the vacillation of trust and people being able to move Similarly, I think you talked quite a bit about the vaccination area. So were they vaccine hesitant? Were they confident? Were in the middle? Were they neutral? And we've done a lot of research in that space as well. So we can explain how it is also dynamic, like people are vaccine ready, but they might not have the access or the kind of the pieces that you're there. So my question relates to how do we, if we can't just develop with access, you mentioned in the book there are other things that could be done, like consensus building and other areas that you thought would help people move in the direction of making appropriate health decisions for themselves and their families and their communities. Can you elaborate on a little bit that, and then we'll go over to the panel?
Sure. I think there are a few other things other than building access, because I mean that I think is an essential piece. And obviously, if somebody's vaccine ready but they don't have access to vaccines, then we have a problem anyway. So that's just a basic building block. But my point has more to do with the fact that people, the feeling of not having access creates a sense of distrust. But in any case, I think some of the other solutions include things like social norming. So making it clear that other people in the social group are doing the behavior that you want the person to do. So if that's getting vaccinated, showing that other people are getting vaccinated in your social group, that's a big piece of it. Also, intervening in the information environment can be very important. And so that can be things like accuracy nudges and inoculation. So accuracy nudges means reminding people before they share information that they should only share things that they think are true. You'd be surprised how mindlessly people share things without thinking about accuracy as a criteria for whether or not they share something. So when you remind people in a very simple way, it makes them share that information less. Or inoculation, giving people a sense of, here are some things you might encounter that are misinformation, and here's the correct information, and here's how to avoid getting pulled into that. So those are just a few. Intervening in the information environment, social norming, and also just building community in general. I think I talked about in my book, like the power of local news and building community to help get away from conspiratorial thinking in particular. So I think anything you can do to build community, and I think we're going to talk about that a little bit in the panel as well, because we have some people here who are experts in that, can help people turn away from conspiracy-based thinking.
Oh, great. I mean, that's you gave a lot of ideas there, and the accuracy nudges are quite important. So one area that you brought up, actually the first quote you had on democracy was on inoculation. And it was inoculation, I think, thinking back to smallpox when we first cowpox. And I think what was very interesting there is people, some of us academics always say evidence-based, science-based, science-based. And there was limited amount of science at the time of cowpox and smallpox. And what was most interesting was that Cotton Mather, a minister in Boston, was much more engaged of wanting to move vaccination forward and test it on people than were some of the scientists in the Franklin family, in fact. So we have to think about unique ways and ways of reaching people where they are amongst people whom they trust. And, that's why we've assembled a panel, and we have Bob Pezzolesi up next, who's a public health advocate, and he's a convener of the Interfaith Public Health Network. And Bob, we really appreciate you being here today. I get a little bit more on the background of what you're engaged with. You're dedicated to building healthier communities by integrating faith-inspired social change with science-based public health policy and practice. You've been the co-founder and co-convener of the Interfaith Public Health Network, a nonprofit organization dedicated to building bridges between faith communities and public health experts to cultivate partnerships to transform public health and advocate for systems and policies that support health and well-being for all. We know the work you did during the COVID pandemic, working with faith partners on designing, distributing targeted outreach materials, promoting COVID mitigation and vaccination, connecting healthcare providers to faith-based vaccination locations in the Bronx. And let us also thank you for being a member of our Pandemic Response Institute Advisory Council. I should mention that you're a consecrated and commissioned home missioner with the United Methodist Church. So, we really would like, obviously, to provide the perspectives that you have on both community engagement, interfaith collaboration, and any items that you'd also like to bring up with Sara. And we'll be coming back to Sara still on this, but over to you, Bob.
Thank you, Scott, and thank you especially for that Cotton Mather anecdote. I had not heard that, and we'll be sure to use that moving forward with some of our interfaith events. So one of the things when we were preparing for this is to offer challenges. What we thought the biggest challenges were to quality health information provision, in addition to kind of the major structural changes that Sara talked about, which are very helpful to think about, particularly as we look at faith communities and their real mission to deal with marginalized populations. I'd like to offer two related challenges. So one is a general lack of science literacy, like Tom Nichols addresses in his book, The Death of Expertise. Looking that in some ways we're the victims of our own success, and that the progress we've had, rooted in scientific specialization, has made many of us kind of passive and confident that so-called common sense is a good enough guide to tackle major health challenges. And so, increasing science literacy, not an easy thing to do, but a necessary step. And the second is the nature of our electronic media systems and their tendency to divide rather than unite people. And that's a phenomenon that's been called cyber balkanization, or the splinter net. And Sara, you talk about some of this in your book. It allows for the quick spreading of mis and disinformation and the blocking of quality health information. And both of those problems are worsened by what Amanda Ripley has called conflict entrepreneurs. So these are people who profit by ginning up controversy without having any real stake in resolving it. And I think these people have always been around. It's just we've got all these structural drivers, including the profitability of target marketing, that make these problems worse. So addressing these problems, of course, is not easy. They're major structural issues. But from our perspective, a lot of it is building bridges across these conflicting identities by enlisting trusted community partners. And of course, for us, that includes people of faith. And that means not only formal faith leaders, but lay leaders that have high levels of social capital in their community. So people that have stepped up and helped with community problems, so that people, when they see their face, I know that person, I know they care about me, they've helped me, they've helped my family, they've helped my neighbors, I can trust them. And toward that end, I was really encouraged in Sara's book about her findings about the efficacy of motivational interviewing. So I guess a question I would have is, what would be the resources and methods to scale that motivational interviewing so that it has a real population level impact? And I'd be, curious to hear from Sara and the other panelists what they think about that.
Great. And Bob, that's just an excellent question. I think we should take that up right now with Sara on the motivational interviewing, and mention it's especially important for us at the Pandemic Response Institute. As you know, we have a whole, I'm engaged with the community work stream, but we have a whole community work stream as well, the communication work stream, the community work stream, and we're doing our best. We work very closely together, right? Our common roots, to use the of what's important here. But I know, Sara, you've given a lot of thought in this space, and also with Critica, I know you have some unique, I don't know what call them, proprietary, but research pieces on your community-oriented motivational interviewing. So what do you think we can do?
Yeah, it's a good question, Bob. I think motivational interviewing is sort of by definition hard to scale because it's resource intensive. It was developed, for people who don't know, it's a form of therapy that was developed in the 80s, mostly for substance use. And it really centers on reflective listening, empathy, finding common ground. And so it requires a back and forth and a trust building that can be quite intensive. But nonetheless, at Critico, we've developed a very short form of motivational interviewing that can be done on social media in just a few exchanges. And we're still sort of measuring the efficacy of this intervention. But and we have some early signs that it's efficacious, but if it proves to be effective, then, what I would like to see is being able to utilize that intervention in healthcare settings where time is of the essence, where providers really don't have a lot of time to spend with patients to counsel them on things like information hygiene. But maybe they could use this very brief form of motivational interviewing to have that conversation. So, and community health workers are probably a big part of the equation there of who could be involved in deploying such an intervention. So those are some of the things that we're trying to test out now.
Great. No, it's good to hear that the focus and the possibility, the resources are always a challenge, right? Of how much, as you say, it's time intensive, human resource intensive as well. And as we often are looking for the new technology answers, whether it's AI, digital, or something, we still need, if I could say, the communication, the dialogue, I think, that you highlighted, not only in the book, but also in the presentation. So we'll come back to you, Bob, if that's okay. And I'm going to move to Adrian. I hope great. Good to see you. I know you've had some camera issues, so I think we have a vertical iPhone, it looks like. But can you hear us okay? I'm going to ask our behind the scenes technical folks. I can't hear Adrian.
You might be on mute, Adrian. Is there an unmute button?
Is there a mute button on your? We can't unmute. Well, since it's a panel, how about Bashir, if you can help sort it out, and we'll go to Sandra, then bring Adrian afterward. So great, good to see you, Sandra. Thank you for joining today. Sandra is no one new to Sara. They've been both with the Nerdy Girls since they were founding members together on this. And Sandra is part of our Pandemic Response Institute with our work that we do with Columbia University at Mailman School of Public Health. Sandra is an assistant professor of epidemiology. I should say Dr. Albrecht, as I also know her. Sandra is a social epidemiologist who studies the social and cultural factors that contribute to both chronic and infectious disease, especially in marginalized populations. She's previously worked at the CDC and New York Department of Health and Mental Hygiene, been engaged in many scientific communication efforts to help individuals, communities, and policymakers make evidence-based decisions around health. Let me mention that, well, it's the founder of Those Nerdy Girls that originally was called Dear Pandemic, and she's also editor-in-chief of the Spanish language sister site, Querida Pandemia, where her work continues to focus on science communication and the challenges of reaching Latinas and Latinos and others from her background, translating science from her Spanish-speaking immigrant family that she shared in her bio. So over to you, Sandra. I know, of course, you've heard Sara. You're very well familiar with many of the pieces in the book, but part of this specifically, especially, if I could say now more than ever, is we're realizing, and we've heard anybody who's followed what happened with the election results. If I could say that, some of the people in the public health community lumped all of Latinos, Hispanics, all the different words that we've used in the past into one group, and that's certainly not the case. And you certainly have had great experience connecting with people on all levels, and even addressing what I think Bob mentioned, the challenges that we face in science and health literacy. Amongst that. So over to you to give an overview of the kind of work and your thinking and what we can do with quality communication.
Yeah, so I just wanted to touch on a few aspects related to the challenges of sort of delivering health information, and especially for communities like Spanish-speaking populations and immigrant populations, which are the ones that I often work with. And a lot of that has to do just my own family background. My family is Spanish-speaking immigrant. And, like you mentioned, I had done work in the Spanish language sister site of what was formerly Dear Pandemic. And so, one of the big challenges is actually, and just more generally, is just finding what those sources of information are for different communities. I think one, even though Dear Pandemic and Those Nerdy Girls has been extremely successful, I will say that the Spanish language site for Querida Pandemia was a little bit less successful. I think the messaging was really good, but part of the challenge was that, not all Spanish speakers, or not many Spanish speakers, especially those that live in the US, were seeking information using, Facebook and the social media outlets that we were operating in. And so, something that I think is a challenge really, and just in general moving forward, and it's also as seen from the election, is just really trying to find what those sources of information are. And they're probably several, it's not probably just one, but looking at, trying to determine what the sources of information are for different communities to better reach them. So I think that's, one big piece of it. Something that I did try to do during the pandemic, and that I continue to do actually, and Sarah actually touched on this, is working with more sort of local news sources. An example here in New York City is that I worked with New York One, especially for the Spanish language, with the Spanish language reporters, and to try to, convey information throughout the pandemic and then allow them to report on it. And so I served as a sort of scientific advisor to the New York One Spanish language reporters there. I also worked a lot with Telemundo and Univision. Again, these tend to be more trusted sources of information and journalism for some of these communities. So I think that was just one way that, we were able to sort of get through a little bit better. But I still think there's a lot more challenges out there. There's still, there are many other social media outlets that, Spanish speakers tend to access, and sometimes more so than English speakers. There's also a lot of mistrust in terms of the healthcare system, and when we talk about lack of access, certainly the Hispanic and Latino population is the group that with the least access to the healthcare system in the US. And I'm sure that also sows a lot of mistrust. So really one big thing is trying to determine what are those, what is the best sources of information? Where do they want to receive their information? And what are those trusted sources of information for these other communities? So I think that's one challenge. And then the second one is, this really goes across the board. And I think this is something that, the group, Those Nerdy Girls, really speaks to. But it's really about, instead of just doing the style of public health messaging that's been traditional for so many years, where you really just tell people what to do, people really want to know why. Why am I doing this? And there's going to be challenges with that in terms of messaging, because you don't have that concise, pithy messaging, if you have to add in information about the mechanisms and why we're engaging in these behaviors, or why people need to do something in particular. So I think, it is a little bit of a challenge. And I found it too when I was, operating Querida Pandemia, because, a lot of our readers had wanted much more concise information than that was being delivered on the English page. But then, the challenge is, well, how do we deliver this content, especially around the why and the mechanism, but in a way that's, impactful for the community that's reading it and trying to receive the information. So I think there's a big challenge of just incorporating that mechanism and the why in some of the messaging, but also, again, in a way that's concise and impactful. And then just the third point, the final point that I wanted to make also, that I think was a huge challenge, and this is not news to Sarah and probably to a lot of us here, but we saw that science was changing very quickly during the pandemic, and this was just very, very confusing to the public. And so the challenge here is how do we message and deliver information related to science when it keeps changing almost daily, or what the public perceive to be just so many, like, rapidly changing science. A lot of people interpreted that as changing opinions. And that wasn't necessarily the case. It's just that the data and the evidence kept changing. But oftentimes, when the data and evidence kept changing, people didn't know, or the public didn't know, that it was because that's how science operates. And it wasn't that because it was a change in opinion, or people had a different, sort of political slant on the science, and that's why that was happening. And so I think filling that gap and helping people understand why the science was changing so rapidly is also key.
Great. No, thank you for bringing all those aspects up, and also reminding on the trusted sources and the great use that you have of working, whether with radio, local media, and so forth. I mean, we do a lot, I could say, with the Pandemic Response Institute, where we're focused in New York, and you might remember those of us in the city, actually the country, may have been watching the daily briefings by then Governor Cuomo, and those often were different communication pieces than what might have been happening with the federal government or even the local government, and all of that builds with the trusted area. And then people like you and Sarah and Bob and others trying to help translate that for the given audiences, sometimes over local media. I mean, we've done a lot of that. And I think one thing that I think with everybody signing up, I want to make sure that you get the newsletters and the link to what PRI, this is the short for Pandemic Response Institute, which has some of Sandra's publications and other pieces, as well as some of these radio clips. I mean, just yesterday I was on WNYC also speaking about the ways that we need to meet people where they are, not where the mass media or the media might be. So how do we do that? We need communities, we need engagement amongst multi-sectors, and also, of course, working with the city, who is the group that has helped sponsor us. So we're going to try again to get Adrian back on, and then we'll come back for a conversation. So let's see, how are we doing, Adrian? We can hear you now?
Can you hear me?
Yes.
Oh my goodness. All right. Well, you don't have to see me.
Okay. Well, those of
I
us
think
we did have a prep meeting, which was great to hear your thoughts. And I'll do an introduction, and
yeah.
then if you do want to try the camera, that'd be great. But we appreciate the support and the engagement with the city, trying to continue to update and upgrade the ability for us to communicate over multiple channels and communities. So Adrian is the Assistant Commissioner of Communication, as I mentioned earlier, at the New York City Department of Health and Mental Hygiene. She's a communication and public policy expert with more than 2 decades of experience creating and implementing strategic communication plans and public policy initiatives for nonprofit organizations, foundations, and government officials. She's also in the past held leadership roles at Planned Parenthood, where she was integral in driving proactive and reactive media strategy to advance Planned Parenthood's health, education, and advocacy agenda, as well as local and statewide communication. Adrian's been leading communication for multiple campaigns as well, including the response to overturning of Roe v. Wade, the 2020 and 2022 elections, fighting state abortion bans, patient education and navigation, national COVID education, and vaccine awareness, and more. We're fortunate to have Adrian not only in her day job with the city, but joining us today to think and to share about some of the challenges that public health agencies have, but also just a perspective on what's being done to overcome mistrust, misinformation, and ensure ideas how both academia, those of us here at the Pandemic Response Institute, and multiple sectors can work together. Many of our goals are to build health literacy, advance trust, promote a healthier society. We're also proud to have a number of our graduates of both of our programs working in the city, working sometimes in the translation and communication amongst, I believe, 13 plus languages that the city department is engaged in. So, Adrian, over to you. And I'm sorry we can't get the full communication. As you know, it's not just verbal and oral, but I know you can do that well.
No, and I really appreciate it. And I just really want to thank you all for including the New York City Department of Health. And I'm actually, be able to share also experiences from my years at Planned Parenthood, which I think all of you can imagine. There is plenty of misinformation, disinformation, and lots of challenges in that space. Currently, and obviously long before COVID. But I think a couple of things I just want, and I think both of our earlier guests really hit upon it. But I think for the health department, there are really kind of 3 key pieces that we really saw was one really, and I think to Sarah's point, there's like misinformation and then disinformation. So disinformation is really that intentional misinformation by bad actors to really try to influence folks into, whether encouraging them to get access to care, discouraging spreading that misinformation, and then just the misinformation itself and how easily it is shared among community members. And I think, Sarah, you mentioned this at the top and really talking like about how quickly people share information without really recognizing or understanding that it's simply not true. So really being able to pull those pieces apart. I think earlier folks also mentioned the real importance of trusted messengers. I know the health department really experienced this during COVID, and as a Planned Parenthood veteran, really important to have those local community members who folks really trust and really can go to them and say, okay, I just want to cut through all this stuff I'm hearing. Really, what are the facts? So really developing those partnerships on the ground, so that those are the people, we meaning agencies, academia, can really go to say, here's the factual information, and really use your influence and connections to get this information to them. And then lastly, and I think this is, a super big challenge, and I think given last Tuesday is going to be an incredible challenge, is really the surveillance of all this misinformation. So there is really that, the social media space where, people are really self-selecting where they are and feeding information that they want to be hearing. But here too is a space back to that community feedback and what is the community hearing? What are they? So that we're able to react not just to what we're seeing kind of in the digital ecosphere, but also we're able to respond in real time to what community is hearing surrounding misinformation. And I think, we've really spent the last week, understanding that, all the things Sarah said up front, really the mistrust in public health, and a lot of that, stemming from personal experience, but also COVID, and how do we really kind of proactively and consistently share factual information, so that we are, when we find ourselves kind of in this misinformation loop, how are we really lifting up the agency and using its voice and a trusted messenger here in New York City to really get that factual information out there. And back to that part of really leveraging those community partnerships to kind of combat misinformation and get the real factual information in folks' hands.
Well, thank you, Adrian. And that question is also echoed in some of the questions that people wrote beforehand. As you may recall, all of you who are listening, you had the opportunity during registration to submit questions. You also have a time now, if you'd like to submit questions using the chat function here. And I think, Sarah, we're going to go back over to you on that question. How do we consistently share? How do we respond to this misinformation mania, or whatever we like to call it, from people that may only be on social platforms or may only get their news or information via some intermediary that's not human even. What do you think?
Does someone else want to jump in? Oh, I thought I heard someone else piping up.
Go ahead, Sarah.
Okay, sorry. Yeah, I mean, I think if it's okay, I want to reflect a little bit on what I just heard from the panelists.
Okay.
And I have, can I ask a few questions?
Sure, but I and maybe Adrian was prepared to answer it because I think she posed it, but part of her job is to try to do that. I thought you were asking rhetorically to all of us. How do we consistently share that? How quickly does it need to be done? We put quality in the title. We want to have quality communication, but quality is not always comprehensive. We need speedy responses that meet people, that feel the emotional need and desire to get, whether it's the facts or the empathy that we've heard. So were you asking that, Adrian, that you think you
No, I said, I think for the last week we've been really thinking through like setting up those systems to be able to do that. And I can share just with this group is really thinking about not just within here in like the New York City Health Department, but how can we bring in other partners to really help us do that? Is that both here in New York City and perhaps other agencies across the US to really kind of build this build an infrastructure to really help combat the misinformation while simultaneously continuing to build partnerships in community so the people, and particularly those who are really targeted with disinformation, can get the information they need.
Mm-hmm. No, great. No, thank you for sharing that, and how the local public health departments are from not only obviously the largest city department in the country, but really ways of knitting this together with both government, communities, and so forth.
Yeah.
Sandra or Bob, you want to comment on that theme? Okay, so back to you, Sara, for some of the reflection. I mean, I think you've given a lot of pieces at the outset clearly on the need for democracy and dialogue and access, but we can't solve these big problems of access. One, in the current political situation, and two, it will take time in any case, while we still have this raft of misinformation that's increasing. Likely, I think I'll just hit it straight on. When Adrian's mentioned in the last week, we have heard that RFK Jr. will have some role in health on the federal level, and we know that he has been historically not only anti-vax, but against some of the scientific findings that we would say would be of value for people making appropriate health decisions. So there are concerns of what could be done. And I think, Bob, you brought this up very well. One of the first things you said is science literacy, and you work closely with different communities and so forth. So how do you think we're going to be able to bridge that if we don't building science and health literacy in ways where we may not have that support, from all levels? So we're not able to necessarily follow the science, but have to build it differently.
Yeah, I think Sara talked about the grassroots approach, and it's unfortunate, of course, in ways to be in that position if we can't trust federal government messaging. And it's certainly folks here, including folks from the health department, would have a better idea about how to deal with that structurally, because it's maybe unprecedented in several ways. But going down at the community level, right, with grassroots connection may be the best way to handle that. And as I said earlier, obviously from our point of view as an organization, we're focusing primarily on faith groups and the ability to build bridges. And Sara, you talked in the book a lot about folks having multiple identities, and if they focus too much on their political identity, they're more likely to believe conspiracy theories and medical mistrust. So some of that, maybe that grassroots approach using faith and other identities to be able to kind of get past those political barriers.
No, I thanks, Bob, for bringing that up and bringing it back to Sara's piece in the book. So what do you think, Sara, on that regard? One, it's the factual addressing of misinformation. You gave some ideas on the accuracy nudges and so forth, but how do you, maybe you just elaborate a little bit more on not only the book, but the pieces that Bob has just mentioned.
Yeah, so I think what he was referring to was I talked in the book a little bit about how identity salience. So depending on what part of people's identity is most salient to them. And so it's not just about what the pieces of your identity are, but it's about how strongly you sort of account for them. So if your political identity is the most important part of your identity, then you might be more likely to become very polarized for obvious reasons because that part of yourself is so strongly emphasized. But if there are other parts of your identity that split it up a little bit more, then you're less likely to be as polarized. And so part of what we're trying to do, and what I think can be done with people, is to try to get them to think about all the different aspects of themselves, not just about one thing like their political identity or their faith identity. Sometimes people get stuck in one particular identity, but trying to get people to think of various types of identities that run the gamut of who they are. That overall, for everybody, is a safer place to be. And so I don't know of any formal program that does that. But
That's
I
what I was
think,
going to ask here. There's some researchers here. They like to figure out how to segment
yeah,
people.
but I think it's a good idea to try, to actually try to do that with people. And you could conceive of a study where you tried to get people to think. I mean, maybe this already exists, where you get people to think more, a little bit, reflecting more about their different parts of their identity, and then see if that helps them, agree less with polarizing political statements or something. So something along those lines.
Okay, so other parts, of course, in this health communication world, as we call it, where as I jumped right to it, how do we segment people, right? We segment them and try to have tailored messages, and go through sort of an approach, and then try to measure, did those work? Well, there's a lot more that could be done, and as you say, people have their identity. This identity salience is a really important piece. So, Sandra, in your work with the Spanish language population, if I can say it like that, how do you feel about this identity salience in unique ways that we may need to address not only the misinformation, but build toward this quality communication?
Yeah, I mean, I totally agree with the fact that, people have different identities. And I think one mistake that was made actually in the recent election is to characterize the Latino population as if it was one identity, right? That believes a certain way. And I think a lot of assumptions were made about, their belief system, and just, and I think there was a real underestimation in terms of the diversity of thought within this huge population. And so, related to that too, and that, I mean, that's also what makes it challenge to message to a particular group of people who are actually quite diverse. We tried to do that by, the sort of the common theme in the group was we had targeted Spanish speakers, and so I think we had some success in some of the messaging. But, there's a lot of diversity in terms of the political spectrum, in terms of, you have people who are, caregivers, who are heads of households, who are young, who are you're old. And so, the message, messaging is going to have to recognize that that some of the way we target people, might be at odds with, the messaging, because there's just much more diversity in terms of the identity. And so I think if, a big step, and Sara was already getting at this too, is just recognizing that, even people who we've long characterized as one group of people actually have multiple identities. And so I think, tapping into that, and tapping into some of the fears and anxieties that come with the various identities that people have, is kind of one way to sort of tailor some of that messaging, because I think the messages that land best seem to be ones that that cater to the fears and anxieties, or rather that address the fears and anxieties that different groups of people have.
Mm-hmm. No, I mean, thank you for explaining that well, and ways that we can really approach it. I'm trying to look, we have both questions that came in during the chat as well, during this in the chat function, and then also that people submitted otherwise. And I'd like to, I think, bring this one forward because I know, Sara, you deal with this at the end of the book, and it also is a question here. What do we learn from other countries? Or are there any effective mechanisms in other countries, one of addressing mis and disinformation, building trust, and are there strategies that we can actually move into the US system? I say that because if we just say, oh, yes, we all should have access like the rest of the world has, certainly OECD countries and others, we don't have that magic wand. So, but what other strategies might we have, and what would you like to highlight for this group?
Some countries after the pandemic implemented some initiatives that directly address misinformation and trust. So one that comes to mind immediately, and everyone should look it up because it's great, is Science Up First in Canada. It's just a really comprehensive initiative that addresses misinformation, science and data literacy, and just kind of prepares the population to be able to navigate scientific information, and also, warns people against what misinformation looks like and how to avoid it and how to, avoid spreading it, etc. Yeah, you put the link in the chat. Thank you. It's a really high quality thing. There was a country in Latin America, which I'm forgetting. I'm sorry, but I'm forgetting which country it was that implemented like an office of scientific understanding or something along those lines to actually directly devoted to working on issues around communicating scientific information, and also this issue around communicating scientific uncertainty. This came up a few times in the panel and is always coming up and is not something that anybody has a great answer to. So this commission or this office in this country is specifically working on ways of figuring out how to best communicate scientific uncertainty and testing different kinds of messages in the general public. So things like this, I think, should be instructive for us. I don't know if they would pass muster in the current administration, or the about to be current administration. But they're maybe a little bit less controversial than trying to pass universal health care, and are still things still things that could help move us in the right direction in terms of more directly. Part of what would help is just to have governmental bodies or commissions that are devoted to some of these issues. And that's what some other countries have done. And it just creates a space for there to be dedicated work and funding on some of this stuff. And it doesn't have to be misinformation, which I know has become sort of like a taboo word, but it can be science literacy or just scientific uncertainty, dealing with scientific uncertainty, or some of these other surrounding health communication, some of these other surrounding issues.
No, thanks for thinking about the different groups. And I did see, I did read in your book, and I did take the note, it was Colombia that has
Colombia, thank you.
Public Communication of Science and Public Outreach Strategy.
Yeah.
And you also highlighted some work in Korea, some work in Spain on pre-bunking, and of course, some of the work, even if we go even farther with what Brazil's done with regulating X, or what some other countries have done of not allowing X, such as China, in their country. So there are different ways to look at this. And thank you for bringing those up. The piece that I think is still, how do we meet people where they are? If 203 million people are on X, and the people that are on X only get their information of any information, or health, whether it's health or political, 56% of them only get it via X. We have to meet people where they are and figure out a way to get, whether it's via that medium with influencers or others. And I know those are some strategies that also have been done, in other countries, and including the World Health Organization, which has, I forget the acronym, but they also have a group, also VDIS, I think is what it is, of influencers where they try to give them health information that they then will spread amongst what they claim 800 million or so followers. But that doesn't mean that that's enough. So very good ideas on a need for commissions and other pieces. And sometimes these are not governmental. And I think you did highlight in the book the need for consensus of different ways. So one of the fifth pieces, which we'll get to go next to a question that's in the chat that everybody can see, is that you mentioned the value of people understanding information being trustworthy or truthful, and was it with four different things, which was, I think, interesting. One, we know, is it compatible with other things that I hold true or believe? Two, is the information correct and coherent or reliable? Three, from a credible source. But I think the fourth thing that we really haven't talked about here, do other people believe it? Is there a social norm there? So that's sort of the what James Fenimore Cooper said, they say as a monarch of the country, it doesn't matter who says it, as long as they believe it. And we have to be really careful to have they, hopefully, which will be science and evidence driven. So I'm going to go to this question in the chat, and then I don't know if Sara or Bob, Adrian, any of you would like to take this. If disinformation comes from these folks, which I think they're basically saying the folks in government, oh, thank you. How can we both counter that misinformation and build trust in institutions? And I think if I don't know SICR 1989 who put this forward, if that is referring to if it comes from the federal government. We can give examples. If you remember during the Ebola crisis, it wasn't the Obama administration answering, but it was Governor Perry in Texas and Governor Jindal in Louisiana and Governor Christie in New Jersey telling people what they needed to know before you would hear from the CDC or the federal government. And I'm just giving the anecdote of those. I'm sure there were lots of other pieces. So who would like to take that? Adrian, I'm going to spare you to go last on this one, given your governmental role. I'll see if other people. Well, Sara, you're the one who's done the most research then in this. What do you think on this regard?
Well, this is a tough one. What do we do? The question is, what do we do when people in the positions that we should trust are the ones who don't trust, right?
Mm-hmm. Yes.
So I think that's obviously very relevant. That's going to be very relevant right now. I think the biggest thing is well, first of all, you need to evaluate whether or not they're right. In some cases, there may be a situation where people in those positions are not trusting of something because there's something wrong. There's something actually wrong with it. So that's one thing to keep in mind. But if it's the case that they're misguided, then I think the biggest thing is to intervene in the level of local communities to make sure that it's not sort of spreading, because that can create a situation where there's a lot of disinformation. So, making sure that you try to figure out what the person's motives are. And explain that to other people so that they can understand, this person may believe these things for X and Y, Z reasons, but that doesn't make it true. And make sure that you're foregrounding with other people, including people in positions of authority who do trust or do believe the correct information, as a counterpoint. And I think that's kind of the best you could do with that one.
Okay. Thanks. I know this is a tough question, but Bob, would you have any thoughts on your work with Interfaith or others of how we try to get what might not be universal truths, but are more factual to the publics?
Yeah, I've been thinking about this recently a lot myself. And if there, a lot of it, again, is going to be connecting to those trusted community partners and trying to explain things in ways so that we both explain where the real science is, but also, what may be the motivations for the incorrect messaging. right? And that's tricky because of the political situation we're in. But I don't know if this means creating kind of alternative structures that are kind of parallel to the government structures, maybe connected to academic institutions that can find ways to kind of correct the governmental inaccuracies in ways that don't feed into the polarization. I know that that's kind of a complicated answer, but I agree with Sarah. I don't think there's any easy answer to it. And I think we're kind of in an unprecedented
Right.
situation here, possibly.
Sandra or Adrian, would you like to address this question?
I mean, this is really hard. We definitely saw this during COVID, and I know again with the Spanish speaking community, there is actually a lot of trust in doctors, and trusting what your doctors say. And unfortunately, there were also a lot of doctors who were quite anti-vax and were pushing other kinds of messaging, and those were the bits of information that were, I would say, the most challenging to undo in the communities that I was talking to, because they were like, oh, the doctor said so, said this, and they're a doctor. And so, I think it's just a sad situation when you have something like that, because, generally we're trying to tell people that, these folks, scientists, clinical personnel, the government, are those that we should trust. And then all of a sudden you have these people in those roles, and now you can't trust them. And that just leads to so much confusion. But I think the best way to kind of think about it is just really going to what Sarah talked about before, and going to the grassroots level, really, and just relying on those people that the communities trust. Also going pretty hyper local with some of this, a very local because especially when you go hyper local, you're more likely to be able to talk to people in person, and not so much, using social media, using these broader outlets, which is hard because you're not reaching as many people. But I also think you have a sort of a more of a touch, and you can communicate better with people when you have that sort of personal touch. And so I think, going more hyper local, more grassroots is something that we might have to do, especially to counter any sort of misinformation that comes from more what we would think would be trusted sources in the government.
Mm-hmm. Thank you. Adrian, would you like to, and then I'll give my on this one, and then we'll go final comments with everyone here. So,
yeah, absolutely. I'm going to say that question is the ultimate question we've been asking ourselves this last week. So if we find ourselves in this situation where, misinformation is specifically coming out of the CDC itself, how do we respond to that, right? When it's coming from the bully, the presidential bully pulpit, how do we do that? And I can say we don't have the answer to that, but I can tell you that it's our number one concern and what we want to tackle. And I think, to the point, one thing is just as our speaker said, that hyper local, getting to community, finding those trusted messengers is going to be key. But, again, so many people just find information in countless ways, self-select into modes of communication that just reinforce their beliefs. So this is really going to be pushing a giant boulder uphill, but I can just share with this group from the the New York City Health Department is our number one priority is really trying to tackle that exact question, and how do we handle it.
Great. Well, thank you for being honest in the challenges, and let me just reflect on. I was at Georgetown Law on a very similar panel this yesterday at the O'Neill Institute, and basically I did get that same question. And let me just say how I answered it. This for legal people, after we were talking about ways of trying to get some policy passed, which is unlikely that the type of things that they were talking about. It was President Lincoln set up the National Academy of Sciences that was supposed to inform on what the best science would be, that then would inform Congress to make policies and so forth. Well, the National Academies aren't able to do that in a timely way, and certainly wouldn't be able to address some of these issues. But I think what Bob mentioned and we didn't plant the seed, but the alternate structure with academic institutions. And that's basically what we're doing with O'Neill. We have a Nature Medicine Commission on Quality Health Information for All that's housed there, that's bringing experts together from around the world, and not just academic experts, but other ways of garnering an information and a roadmap to be able to not only have, I don't want to say rapid response, but at least of evidence or evidence-driven, not always evidence-based. We have to have either evidence-driven or scientific or theoretically driven activities to push forward innovatively. And that's what we hope to be doing. And all hands need to be on deck. And I do want to pay attention to what Susan put in the chat. What about nurses? I mean, nurses are they're the largest health profession that are organized on a global level with the International Council of Nurses, and clearly here in the US. They're also, frankly, they test higher on the trustworthy scale many times than physicians or others or pharmacists, and they're down very much at a local level, all the way down from nurses to oftentimes where community health workers and others are overlapping as part of the care team. So, yeah, by all means, we need to figure out how to do this better, and there are lots of other ways to work with them. So Susan, thank you for bringing that up. And whether it's with our PRI or other groups, we need to reach out. Also, as Sandra mentioned, with the professions and all this. So I'm going to go around and just sort of give the opportunity for each of the panelists to reflect on what they've heard today. Sara, you'll sort of get the last piece on I know you put some ideas forward at the beginning that you shared with us, but also in your book and also on reflection here today. And then we'll wrap this up and give the time back under the 90 minutes that we've allotted. So with that, Sandra, I'm looking at you. I think you're ready to go of what you think are next steps. And you're a partner with our communication team at PRI, so we know we're going to do this together.
Yeah, I mean, yeah, it's going to be a challenging road ahead, but I also like the idea of doing sort of parallel communication and parallel trust building. And then I also just want to encourage, I mean, this is something that we had done in the very early days of Dear Pandemic and those nerdy girls, and encouraging just other scientists, other clinicians. There's a lot, the healthcare force is huge in the United States, but just encouraging, just each individual to voice, to spread good information, even in your own personal networks, with your family, with your friends. I think we're in an era of trying to encourage more scientists to engage with the public. And I think that should keep going. We're going to need it more than ever. And so I think, at a small scale, when people are wondering, well, what can I do, about this moving forward? And I think if you're in a position where you do science, where you work in healthcare, I think start engaging more with your own personal networks and trying to get good information out there.
Great. No, thank you. Excellent points. Adrienne?
Yeah. Hi. I just want to triple click on what Sara just said. Never underestimate the influence folks can have. I've been at the health department 11 months, and I said, 7,000 people work here, and we have 7,000 ambassadors to really elevate and provide factual information. I think the one thing I would say as a communicator in this space and less is one thing that's really important for folks to remember is if the facts don't fit the frame, the facts are rejected. So as we're thinking about how we communicate, it gets to that point of meeting people where they are, messaging in a way that they can hear you, because if it's not in the framework for which they're already in, that factual piece will just quickly go out the window. So as we kind of have these challenges ahead, and again, to the question in the chat about intentional mis and disinformation, how we handle it, I think one thing always keeping in mind, ensuring that we are framing it in a way that people can really hear us and understand.
No, great. No, thank you. Facts fitting the frame. So
yep.
Well said. And that 7,000 ambassadors, we won't forget.
We have.
Okay. Bob?
Yeah, so on a hopeful note, during the COVID pandemic, the faith communities were really turned to, and we founded IPHN, with the belief that faith communities were underutilized partners for public health. And DOHMH and health and hospitals did a really good job of utilizing faith partners for the pandemic. It was really impressive how they stepped up for that. So, I think that's something in terms of faith communities that we can continue those relationships and use those community relationships, to get through the next period and hopefully build on that. And then secondly, to find the good news and the bad news. I think, I was encouraged with Sara's identification of healthcare access and structural racism as being, factors in what we're dealing with in terms of medical mistrust and belief in conspiracies. And as tough as those problems are, it shows that if we're kind of all pulling in the same direction in public health, we'll be able to solve some of those problems more quickly by kind of synergizing those efforts instead of seeing them as splintered. So again, very, very daunting, but doable.
Thank you. Thank you for the optimism on doable. And we're working together with this. Sara, and then I'm going to still have my last piece at the end of the.
Sure. I think a great through line through everybody's comments had to do with trusted messengers and local communities. So one thing I want to impress on everybody is that I found in my research for the book that local engagement was one of the most important things, determiners of trust, that the more people were engaged with their local communities, the more they trusted healthcare, the government, et cetera. It was like magic. So I think one big part of this that keeps communities tightly knit is actually local news. So to the extent that we can support local news, advocate for local news, I think that's going to actually be really important. It might seem like it's not that connected to healthcare, but it really is. So that's one piece. And then I would also say, I think we really need to think carefully about how we prioritize our interventions around whether we're working on the downstream effects of misinformation, like the way that it's being spread all around the internet, or are we focusing on the disinformation peddlers who are the ones who are originating a lot of the misinformation? And do we want to have strategies to kind of go after those people? I think that's kind of an open question in the misinformation world, but something that we need to think very carefully about, and whether we want to change our approach a little bit. And then the other thing I would say is just that I think a lot of you probably know this, but one of the most important things to keep in mind when it comes to misinformation is that we don't want to think about it in a knowledge deficit framework where we think that people just don't have enough information or they don't have the right information. Sometimes that's the case, but most often we're dealing with a faulty information environment and social influences and things along those lines. So we have to really think holistically about what's driving the misinformation problem and not focus so much on individual pieces of information.
Well, so it is the daunting task was right, and you certainly brought that all together at the end, Sara, with the social influencing and how we have to think and have our hierarchy. Let me just thank all of you. This was just a very rich discussion. We could keep going, and we'll ask people who've listened if they want a sequel. We do courses and stuff on this, and we at PRI really want to do what we can best for the communities in which we serve. And broadly speaking, all of this does not end in the boroughs of New York City. We know the reality of communication traveling and misinformation traveling even faster than shall we say the quality communication that many of us are espousing. But Bashar, I want to thank you for the vaccine, Bashar Mackay, who's been putting these pieces up here. As you can see, there's some more to learn about that's in the chat. But it's not only Bashar who's done some great work. There's others behind the scenes at PRI who had not spoken but organized this. So I want to thank Mitch Stripling. I want to thank Cameron Nahar, and of course Daniel Green, who's also helps advance what we're trying to do with PRI. There's some pieces now. We have a journal from the comms team. There's other pieces that are there. And, we just would like you all to know that we are here for addressing, hopefully, I say hopefully not a pandemic soon, but even outbreaks before they become epidemics, before we use the appropriate language to warn people and also to prepare for the next. We'll do our best. We really appreciate having the support from the city and Adrian really with representing the team of 7,000 and I'm bringing the background here. So thank you. Thank you again, Sandra Mailman. We look forward to hearing more and keep spreading the local pieces, as Sara mentioned, in the multiple language and dialects that we need. Bob, the interfaith groups, we're really appreciative of your support and serving on the PRI advisory group. And Sara, this is not the first time you've been presenting this, and each time we learn more. Each time you bring great ideas forward and ways from the different disciplines that are necessary, because I think as all of us have said, we know some of the things that are right, but it's a rapidly changing environment and we need to be prepared and have great people ready to do that. So we hope to continue that here at PRI. Let me also thank one of my co-leads on the communication team at the Pandemic Response Institute, Chris Palmado, who's also a professor at CUNY School of Public Health, who helps in immeasurable ways, notwithstanding, helping put this together in our interfaith work amongst all the different communities. So thanks to all. I'm trying to go right on time. I think I'm about 30 seconds over. So we'll hope to see all of you again, and know that you can also reach us with email and other ways. Thanks very much.
Thanks very much. Have a great day.
Thank you.